Welcome to CardioVisual. I'm Seema Mathur. We are continuing our Therapeutic Breathwork series with Dr. Amit Anand, a Boston-based pulmonologist and sleep doctor. Dr. Anand combines his Western medical training to teach centuries-old Indian pranayama breathwork. Dr. Anand, so excited to have you back today and to be with you again, and also Clint Valladares, amazing musician who you also see on the screen, who they both work together, which you all are going to hear. But Dr. Anand, what are you going to teach today?
Seema, good morning. Great to see you and be with you and Clint this morning. Today's session is more of an extension on what we did 2 weeks ago on slow breathing, how to develop a consistent practice of slow breathing, and talking about its applications, but also with an emphasis on the sound of the breath and the prolongation of the exhale, what we called the Brahmari breath or the buzzing bee breath.
That's my favorite one. And for everyone who's following along with us, it doesn't matter if you saw last time or not, because each of these sessions that are about 20 minutes can be independent of each other. So it is okay if you're just starting today. And again, to remind everybody that we are going to learn these techniques together, do it together. And so the positioning is to be comfortable and to sit upright. And so while you're getting yourself into a comfortable position, I do want to ask one of the questions that came in from our viewers last time that I know that you wanted to address on one of the healing aspects. And that is from a person who was completing cancer treatments and chemotherapy. And they specifically wanted to know how the breathing techniques that we learned last time could help them with their support their healing.
Yeah, no, that's a very, very important question. Cancer, obviously, it's a frightening diagnosis. The treatments can be devastating on the neuroendocrine system, on the immune system, and sets up a cascade of inflammation, within our physiology. Breath work, when done consistently, even for brief periods, as we talked about last time, is about modulating the autonomic nervous system from a straight state of stress, which is sympathetic charge, to a state of calm, where we are moving the axis towards the parasympathetic. And as we do so, it turns out that with vagal enhancement or vagal modulation, there are benefits on the inflammatory cascade. It suppresses, in some ways, the pro-inflammatory response. And then when you introduce the value of music, which we'll talk about a little more, with some of the active exercises that you're doing, there's another soothing element through the neuroendocrine immunomodulating pathways. So it can be very valuable for anyone who's going through chemotherapy or any other sort of form of cancer treatment by just integrating a little bit of some of these practices, even 5 minutes twice a day or 3 times a day, to help reset the inflammatory cascade.
I mean, we know that when we start breathing fast, our heartbeat goes up faster. So in the same way, controlling the breath can have a positive impact, right, on our heartbeat and on our stress levels. And I believe that's part of what you're going to teach today in the Brahmari breath and breathfully slow. So we'll get started with your instruction and come back with a few questions, and everybody else too. Please feel free to send in your questions. But most importantly, do this along with us. So, okay, here we go. Brahmari, breathfully slow.
Thank you, Seema. So today's technique is about, again, slow breathing, but slightly different from what we learned 2 weeks ago. Again, a lot of emphasis on the exhale, because that's where the work on breath work is. Normally, the act of breathing is a active inhale and a passive exhale. As soon as we bring activity to the exhale stroke, we are modulating the autonomic axis. So how do we do this? And why do we do this? Turns out that when you start to work on the exhale and you slow it down, you are shifting from sympathetic to parasympathetic. When you start to get into a resonant rhythm, not only with the sound of breath, but with resonant frequency breathing. So, as we talked about again, somewhere between 4 to 7 breaths per minute, there is complete coherence between gas exchange, cardiovascular control, posture, because you're doing it upright, and the emotional system. There's a sense of peace, there's a sense of calm, there's a sense of clarity. In fact, all of pranayama, even though we are using the instrument that is breath to manipulate prana, which is vital energy within our bodies, our minds, is really about attaining a pristine mind. It's about settling the mind. And we live a life of stress. We live a life of hectic pace. If we had to look back to the wisdom teachings of what are called the Yoga Sutras of Patanjali, where all of this pranayama teaching comes from, it's 6,000 years old. It's written in prose, in Sanskrit, and there are 992 aphorisms in this book. And it says that if you learn the first 4 aphorisms and you understand them correctly, you will appreciate what the remaining 188 are talking about in terms of the technique, the practice for the individual. So what are those first 4? Now begins the exposition of yoga. Yoga, number 2, is the progressive settling down of the mind until it is silent. Not of the body, not of the breath, of the mind until it is silent. Number 3, when the mind is silent, we are established in our essential state of being. We are human beings, after all. We have come to confuse ourselves as human doings, human breathings in 100 different directions. But we are human beings at our essence, at our core. And number 4, our essential state of being is generally overshadowed by the activity of the mind, by this clutter, by this thought. So all of the practices that are then espoused in this wisdom book of Patanjali teach us how to get there. And pranayama is one methodology of getting there. We use sound as an instrument to actually settle the mind. The whole teaching of mantra, man, mind, tra, instrument of, is the use of words, pre-linguistic or vibrational in quality, repeated silently within our mind to actually transcend mental activity. Similarly with breath. When you start to bring activity to the breath and then you introduce sound on the exhale, you are also, without knowing it, stilling mental activity, bringing some quietude, some quiescence to the mind. And then magically, after the practice, you will find a sense of peace. And sometimes you will find that that sense of distraction is way more settled than it had been before you started the practice. So that's the beauty of using breath as the instrument, but with the value of sound. And why sound? Because sound is actually the most subtle of all our senses. We hear our thoughts. There's another beautiful aphorism in one of the wisdom books which says that the essence of earth, the most subtle aspect of earth, is water. The essence of water is plants. The essence of plants is the human being. The essence of the human being is speech. The essence of speech is thought. The essence of thought is sound. The essence of sound is pre-linguistic sound or vibration. And the essence of vibration or primordial sound is awareness. So you're using sound with breath to actually settle the mind, to come into that value of stillness where you attain a pristine quality to the experience. So we're going to talk about the buzzing bee breath, Brahmari Pranayama, or what I like to call the humming breath, the hum breath. On this breath, there will be an emphasis on the exhale because we're going to make this twice as long as the inhale. So if I start with a 5-second inhale, my exhale is going to be 10 seconds in duration. It's all going to be through the nose, in through the nose, out through the nose with that hum. And we're going to do it with vigor, at a pitch or a tone that is comfortable for us. And once we start to hum on the exhale breath and we lose that vigor, then we complete the rest of the exhale silently until the next inhale starts through the nose. Right? So it's actually pretty simple. Inhale through the nose, exhale twice as long through the nose at a pitch or a tone what that hum brings to you with vigor. Once we do this for about a minute, then I will have you actually seal the ears with the thumbs and close the eyes and pad the eyeballs with the tips of your fingers very gently as you generate this hum. And we'll do this for about 90 seconds. So it's going to look like this and sound like this. So it's an inhale through the nose. And we'll repeat this. Inhale through the nose, exhale through the nose with that hum, with vigor. After we do that practice, sealing the ears and padding the eyeballs with the tips of the fingers for about 90 seconds, we'll bring the hands down and we'll continue to do it, but we'll change the tone. So we'll go from a slightly higher pitch tone to a lower pitch tone. So you can start to appreciate what even tonality has to do with the experience. And that's where music comes in, because the musicality of the practice, the tone, the rhythm, the reward, the social connectivity, when it's all done together, can be very powerful. All right. So it's a simple technique, the humming breath, inhale nose, exhale nose with the hum. About a minute into the practice, I'll have you bring the ears plugged with the thumbs, the eyeballs padded with the tips. For another 90 seconds, your hands will come down, your eyes will remain closed, and we'll conclude with a lower pitch sound. All right. So let's get going. Sit tall, close the eyes, bring the awareness within, and let's begin. Inhale nose, exhale nose. Inhale nose, exhale nose, twice as long. Inhale nose, now exhale hum. Inhale nose, inhale nose, hum. Inhale nose, with vigor, hum. Again, in nose, in nose, Now seal the ears with the thumbs, pad the eyeballs, tips of the fingers, inhale nose. In nose. In nose. In nose. In nose. In nose. Slightly lower. Now bring the hands down, keep the eyes closed. Now we'll resonate at a lower pitch. In nose. Feel that vibration, feel that hum. In nose. In again. In nose. Out, hum. In nose. Bigger, slow it down. In nose. Releasing from the practice, coming back to normal breathing. Watching it happen rather than making it happen. Just becoming fully aware of the experience, body, breath, and mind. And as you feel ready, just gently open the eyes. So that was Brahmari Pranayama, the buzzing bee breath or the humming breath, a very powerful practice. When you do this, you create that humming sound in the face, in the scalp. When you plug the ears, you feel it even stronger. That vibration, there's a clarity that starts to envelop the awareness. There's a warmth that starts to envelop the awareness, and there's a calm that also follows. I'll let
Really is.
Clint take over because I wanted him to also explain, Seema, about
Yeah,
how he chooses the sounds.
I'm so curious about that, Clint, because we hear that sound, that buzzing sound, and I'm curious about that frequency. And then when Dr. Anand said to do it deeper, that must be another frequency. So can you explain what is happening there?
So thank you, Seema. Thank you, Amit. Can you guys hear me?
Can
We
you hear
can
you?
hear you.
So the important part about this is after observing Dr. Amit put this practice together, we thought about when does this happen? How do we naturally connect with the environment? And we realized that bees leave the hive early in the morning at sunrise. And so in order for us to create music that connects with our soul in the morning, we wanted to create happy vibes and happy rhythms rather than, something that's very dramatic, that's kind of a minor kind of vibe. So if I used a minor chord, I'd use a chord like this. That doesn't seem very happy in the morning. So
Mhm.
use a major chord, which would be a chord like this. And this is in a register that is very comfortable with most people. So
So what
you can connect with it.
Clint, sorry to jump in like that, but so what is what when we hear that buzzing, what chord is that? Our natural buzzing that we make in this. What how would you describe that?
That comes from the open string in a guitar, which has that vibration. It's the E string. That's an open string on a guitar.
And
So
that feels so relaxing. That string.
yes, yes, it does. And that's why we are very deliberate on these tones, sounds, frequency, time of day, and what we feel as human beings. So we make this very natural rather than it becoming too complicated. The music should not get in the way. The music supports the breath.
But it is amazing also how you compose the music to actually be that natural feeling, that feeling, that sound and that frequency when we're doing this Brahmari, that you compose it in that way to actually support that.
Yes, it's rhythm, which is the heartbeat, your soul. It's the harmony that comes from then you have the melody that is guiding you through. So you have a little bell that you hear that actually guides you when to breathe a certain way and when the inhale is coming through. And so Dr. Anand is very deliberate about guiding you now, but the music will guide you in your practice at home.
It really does. You can hear the shift in the note and know when to exhale. And so that's also really nice about this because once you start going into this and into this practice, you want to start doing it by yourself. And so it's really nice to hear um, exhale intuitively through the music versus a continuation of guidance so that you can be with your own self a little bit more. So that's yeah, that's really amazing in that. I'm curious too because when you were talking about Dr. Anand, you were talking about the vibration that we're hearing in this, and that vibration creates awareness. Can you explain that a little bit more?
So were you using the vibration and the sound of breath to actually almost trick the mind into not thinking? That's what a mantra is. This is like a mantra to the breath. When you add the sound, it kind of just brings you very, very quickly within because it's working, the breath, the axis, the corridor of the breath. And as you come into the body, you come out of the mind. And the sound of breath, the musical notes to the practice actually has a very quick way of bringing you right to your core. Uh, there's a real value to this practice also. I mean, physiologically, if you had to sample nitric oxide in your sinuses, nitric oxide is a very potent vasodilator in human biology. We now know that with the humming practice, it is increased 15-fold. 15-fold. So with oscillating humming practices like this on the humming breath, now what does that mean? Well, we don't know as yet. But when you vasodilate to that extent, it's probably going to have some benefit in inflammatory conditions of the upper airway, the sinuses, the nasal membrane, the ostia,
Mhm.
allergic disease. So I think there's research that's going to come out on this in addition to some other nasal breathwork practices. But I know, Seema, you've also been doing breathwork and breathwork probably with music and music as therapy. I'd love for you to share your story. It's been very
Both,
inspiring to hear.
both, and um, I can't wait to actually have you and Clint on along with this other amazing musician Yuval Ron. We've been hashtagging Brain in Progress because soon I'm going to share my story and share what also helped me heal. But in short, I had brain surgery, and after this last brain surgery that I had, it felt like it was a war in my mind, and I started to listen to this music that was, as you composed, Clint, like very specifically, and also doing the breath work, doing the pranayama. Especially, I said earlier that Brahmari is my favorite. I
Yeah,
didn't know how it worked, but I knew that I felt a sense of peace and calm, and it sort of regulated that, like I said, that war that was going on, and just brought a sense of calm and also clarity. And I'm always worried about cognition, and I really felt in those aspects that it really helped me as well too, to be able to think more clearly again after a brain surgery. So it's been huge in my healing journey, and one of the reasons I'm so excited to be here with both of you and to learn more about how it worked as well.
that's amazing. Yeah, music therapy as a field. I mean, Clint will speak to this more, but it's really exploded in the last, I would say, 20, 25 years. Using uh, the sound, the vibrational aspect of music as a healing tool. And there's a panoply of conditions to which music can be applied. I mean, your mother sings to you when you're in infancy. It has a soothing
Right.
effect on the baby. I mean,
Hmm.
all the way to the end game. When in hospice, we are now using music for the departing soul. There are applications in neurodegenerative conditions, dementia, Parkinsonism, for people who are rehabilitating from strokes. There are applications in peak performance, elite athletes for mental health issues, panic, anxiety, even mood disorders. I mean, there's so much applicability, but the language of music as therapy is now starting to consolidate over the last
I
few
think
years. And I'm so excited that
same,
musicians are a
so.
part of the healing paradigm now.
Absolutely. And Clint has said, about music being a universal language. And I think that's why it can work, cross-culturally like that. And for, different applications because of that universal note, right? That it's like the same when we listen to the note that you played earlier, the calming one that you said was more for the morning. You can instantly feel that. The first note that you played, in contrast, it felt like suspense movie. And it's like, how do we know that? Because of that universality of it. So it's really amazing. But going to the applications, we did get a really interesting question that I'm sure resonates with a lot of people. That want the person wants to know how it could help them after suffering from COVID. And we hear a lot about the brain fog that has happened post COVID. Uh, can this help that person and others like them?
Yes, the answer to that is yes. This amongst some other techniques, which I will be sharing with you as the series moves along, can be very powerful. Remember, COVID enters right here at the roof of the nose. That's where it enters the system. And that's why a lot of people, when they came down with COVID, they lost their sense of smell. This is the portal of entry. And it turns out that in pranayama, of the four receptacles of prana in the body, the nose is the most important. So as we develop a nasal practice, nostril over mouth dominance, a slow practice, there are wonderful aspects that start to happen with gas exchange, oxygen, CO2, blood pressure, and also the brain-body connection. So we'll get into this a lot more, but yes, this is a very powerful nasal practice which espouses healing from deep within.
We've also been talking about any contraindications, anything that might not be particularly safe for anyone. Is there anybody that this Brahmari, what we learned today, might not be safe for, or any adjustments?
Anyone can do this. They all have to just figure out what their resonant rhythm is. So today we practice at 5 to 10. That might be a little too strenuous for someone who's got small lungs, who breathes at an inhale of 3 or an exhale of 6 or 4 and 8. So you have to find your resonant rhythm and work it. But anyone can hum, right? We're all speaking. We speak on the exhale. We're just changing the tonality and the speech production now with a hum on the exhale. And when we do that, it's very, very soothing, very, very powerful. So anyone can do it. No contraindications at all.
Can we still get the same impact if you can't hold that long and you exhale a little bit quicker or faster? Would it still be the same impact?
Totally. So it's about controlling the exhale, bringing uniformity to the exhale from the beginning to the end of the exhale. Then obviously some of us are going to lose steam. So when you lose steam, you let the rest of the exhale complete silently. So there may be a little bit of a pause, and that's okay before you take that subsequent inhale. And when you take that subsequent inhale, once you've let it out completely, you will find that your lung capacity for that inhale actually increases. And when it does, there'll be more steam on the following exhale. So you will learn to play with the exhale portion of the breath, which is where the work is. In time, that 3 to 6 will become 4 to 8, will become 5 to 10.
Mm-hmm.
Yes.
And we're getting another question that they want to know: should this be done only in the morning?
In fact, in the morning, it's a wonderful way to clear the lethargy, from the preceding night. So it's a really soothing, alerting, warming, let's go practice. There are some other practices that also sort of stride by Brahmari. Turns out that when you hum, you're also toning the dilator muscles of the pharynx. And in India, this is used as a prescription for people who snore. So if you
Huh.
start to develop a Brahmari practice in the evening before sleep, doesn't have to be long, it also helps the upper airway patency, the dilator muscle. So you can do it even at night. But the
Could save a lot of
tonality will
marriages,
probably
huh?
be different. Yeah.
That's great. So any time would be good. Okay, well, we are unfortunately out of time now, but we are going to do this again. So we're doing this every other Wednesday. So that will be on April 30th that we will be back here again. And of course, we're getting the appetizers here, the instructions, but going to Breathinance is the whole program that you have created, along with scientific explanations, PDFs, and what we're learning today, and much more. So we've got more coming on April 30th on Wednesday. So look forward to seeing everybody and getting to more questions.